Oh, you just got your ears.
Hello, good morning. Welcome to this week's staff brief. I'm Paul Robinson. I'm the Chief Executive here at Sherwood, and today I've got quite a number of guests with me. So I'll just do a quick rundown of who's with us. Amy Gouldstone, our People and Wellbeing Lead. Dave Selwyn, Medical Director and Deputy Chief Executive. And then a group of people from Project Search. Martin, Louise, Laura, Lisa, Andrea and Helen will all join us to talk us about Project Search. And in the background, we've got Jess Baxter doing all the wonderful wizardry and keeping us all on our toes. So thank you to everyone for joining us. Just before I hand over to Amy, who's going to talk about the cost of living support that's available across the trust, I'll just give a few sort of general updates. So firstly, on industrial action, we've launched a dedicated intranet page to support everyone by sharing information and everything that you're likely to know about the planned industrial action that's likely to take place across the NHS this winter. This intranet page shares latest information that we have and any updates from the trust-wide planning group, which is working to oversee our efforts to maintain safe patient care during any periods of industrial action. The page contains dates of confirmed action, news of work going on behind the scenes to prepare, and a comprehensive list of frequently asked questions for line managers and for individuals. So it's something for everyone in there. Page will be updated as more is known about any planned industrial action, with the latest updates being shared following the news of the Royal College of Nursing's confirming that its members in some trusts are taking action on Thursday the 15th and Tuesday the 20th of December. Whilst the RCN did not meet the threshold to take industrial action here at Sherwood on these dates, we know that there will be impact across the NHS and indeed locally as members of the RCN at Nottingham University Hospitals and Nottinghamshire Healthcare are likely to be included in that action on those days. So we'll share any further updates via the industrial action intranet page, in the bulletin and in any of the staff updates as needed. Okay, so every week talk about flu and COVID vaccinations and urge everyone to get protected, and I'm continuing to do that. So we know that there's lots of colleagues who've had vaccinations so far. Nearly 58% of frontline colleagues have had their flu jabs, and we did better than that in the past. So we know we can encourage you to do better this year. Medicine division have the highest uptake so far with a total of 54%. So well done to you. The team are outside Minster Ward today. So if you're at Newark today, outside Minster Ward until 2 o'clock, and you can pick up there your flu and COVID vaccinations until 2 o'clock. So look out for the team who'll be holding further pop-up clinics at Kings Mill this week. So by the lifts at Kings Mill over the coming days. There's also peer vaccinators on most wards who can provide you with a flu vaccination if you so wish. You can book your appointments for either of the vaccinations, and Jess will post the links in the chat. And don't forget that if you receive your flu jab, you'll also be given a free meal voucher to be used in the Spice of Life restaurant, and also into a multi-prize draw. And the flu increase. We've got increased flu numbers of patients across the trust, so really important that you get that vaccination, not only to protect yourself, but also your team and your patients. So further, I just mentioned Spice of Life restaurant. There's a staff discount at the Spice of Life restaurants up until the end of January. So 50% off hot food for all colleagues at Sherwood Forest. Valid from now until the end of January, as I mentioned, and across all 3 sites. So this includes a Spice of Life restaurant at Kings Mill Hospital, that's on level 6, Spice of Life restaurant at Newark on the ground floor, and the cafe at Mansfield Community Hospital. Just got to add a note of caution, the offer does not include Costa. So Spice of Life restaurants only. Lastly, before I hand over to Amy, just a reminder about Meet Your Governor events that are taking place throughout this week. For colleagues at Kingsmill, you can find your governor in the KTC on Monday the 12th from 3 o'clock until 5 in the afternoon. And then again on Wednesday the 14th of December in the morning between 9 and 11. And for colleagues at Newark Hospital, Meet Your Governor taking place on Thursday the 15th of December between 1 and 3 in the afternoon. Okay, so they're the general updates. If anyone has any questions as we go, please post them in the chat. And with that, I'll hand over to Amy Gouldstone to discuss cost of living support available for colleagues. Thanks, Amy.
Thanks, Paul. Wait for me. Hello, everybody. So those that haven't met me before, I'm the People Wellbeing Lead here at Sherwood Forest. My name is Amy Gouldstone, as it says above my head. I'm really glad to be here on our Christmas jumper day as well. Not that you can see too much of Christmas jumpers. I really wanted to come on to talk to you before Christmas about cost of living. I think it's something that's on a lot of people's minds. It's in discussions across the office, probably with friends and family. And I suppose what we can do from a wellbeing perspective is help people's money go further. So I've got a few things to show you. I'm going to screen share in a minute to show you a couple of websites and show you how to find the financial wellbeing resources that we've got in the trust. The first thing I wanted to share with you is that there's a website and a service called Money Helper, which some people might have known as Money and Pension Service. It's available to anyone, so your family and friends as well, but it's such a good resource and website for people to use. So it's got things like budget tools on there. For example, if you're thinking about having a baby, right, this is the one I used personally. It kind of breaks down some of the costs of things that you might need to consider on there. There's things on pensions if you come to retirement age in terms of planning. But I'm sorry, I'm not sharing my screen, so just share my screen so you can see the website as well. The other bit I wanted to mention was the debt support side of things as well. So on the website, you'll see there is a phone number, there's a get in touch online, you can chat to them on web chat online. Generally they're in office hours, I think, till 6 p.m. But the Money Troubles tab has got a really good section on dealing with debt. So there's two sides to this. There's on the dealing with debt side of things, if you scroll down, you can locate a free debt advisor. So if anyone in your family is struggling anywhere in the UK, you can click on there. Or the Money Navigator tool is where you perhaps don't want to speak to someone about what's going on, but you're not really sure what to do first, what to pay first. So that's quite a good tool to use. You put in and it will advise you what bills you should sort of work on first, if that makes sense. So I say it's a really a big resource, really. Actually, there's quite a lot more on that, but again, wanting to sort of, where possible, kind of think ahead of time. A lot of people get to January, February, and they're really struggling because of the festive period celebrations and buying things. And I suppose that comes on to the next bit that I was going to talk to you about, really, was that pressure to purchase things for whether it's friends, family, and spend on kind of days out and things like that. And actually we've had some interesting conversations with colleagues so far when we've done sessions on wider wellbeing. The things that people are doing this year to save money has been really interesting, and I've personally received some digital Christmas cards already, which has been really good, quite good for climate action as well. Got people doing secret Santas so that they're not buying for lots of people. So we're doing this in our family. So instead of buying for, I think there's 6 of us, we're all buying for one person at £60 basically budget, which is half of what we'd normally spend. And I'm doing that on both sides of my family. So again, a way of saving, but hopefully a way of making sure that we kind of still celebrate and do some of the things we like to do and give at Christmas. So I'd really encourage these conversations to be happening in teams, really, even though it's home related. There'll be things that people know about, discounts or savings that people have come up with that you might want to share amongst each other. So the next website I was going to share, so if you could, Jess, if you could pop back I don't know if I'm on, I think it's me at the moment, but onto the website sharing that I've got here. When you go on the intranet, and you scroll down past the picture about flu and COVID vaccines, of course, really important, you'll see a purple box here about our staff or colleague welfare and wellbeing. And I'm showing you this because there's quite a few clicks, but rather than you having to dig out a link, this is where you'll find it. So on here is all our wellbeing support, so our mental health support, all sorts. But VivUp is our provider that help us with all sorts, whether it's counselling or in the moment support. They also support us with our staff benefits. So when you click on the big picture banner of VivUp or the link for VivUp, you'll see all the different options. Scroll down and you go to access benefits. Now, if I've done this right, my blue Peter up here, I did it earlier, so I logged in earlier. If you've never registered for this, you'll need to register with your employee number. If you have registered before, you'll just log in. I log in with my personal email address, which really threw me when I was trying to work out this a few days ago. So do try and log in with your personal email address if your work one doesn't work. But on here, there's all the schemes that you can access: cycle to work, lease cars, if you need to buy home electronics through your salary. But the one that I'm most excited about and wanted to show you before Christmas was the option to buy gift cards that are topped up, basically. So just gone down to that bottom left, and this is sort of the search area for gift cards of all sorts of stores. And so I'll use Asda for an example, because we could buy our food shopping perhaps from there, and I think all our sites have got an Asda quite close. You click on this voucher, you go to order, and basically if you want a £50 gift card, you can actually select multiple amounts. You get a discount on that £50 gift card. So I probably should have done it with £100 because it's easier, but £50 is easy too. So I only have to pay £48 for a £50 Asda gift card. But there's absolutely loads on there. There's Sainsbury's, there's Tesco, there's I can't even remember. Oh, there's restaurants and things like that you'll find. But you can use a search function to find things. Days out. All sorts. John Lewis is on there as well, as you can see. But really wanted to show you that because it doesn't cost you anything, and it can give you savings. But the great thing about it as well is you can use it in addition to NHS discounts. So a lot of people will have heard about the blue light card. This is probably the simplest way, and it's the one that's most accepted, but you do have to pay for a blue light card. It's about £5 for 2 years. But for example, in Asda at the moment, until the end of December, you get 10% off in Asda. So unfortunately, I suppose most food shops in the week go above £50, so you soon get your £5 back, basically. But you could double that up with using your Asda gift card to pay for your shopping, which gives you an extra 4%, 10% off. And if you're really savvy and you've got the app on your phone, you can get the Asda Rewards app as well. So I'm just using that one as an example. But it can really help to save. It can save people hundreds, if not thousands of pounds a year. So that's why I wanted to bring those on. And then bring it on before Christmas while you're still doing some spending, particularly. So blue light card, actually, if you just use any search engine, or the one that rhymes with frugal, you can find blue light card and register and log in, and you'll get a physical card, but you can also have the card on your on an app as well, which is what personally I use because I never carry cards anymore. But the app, again, this makes it really easy to check of where discounts might be available. So that's how to save a little bit of money in a very short period of time. A couple of things to let you know about as well. On the 15th of December at 12 noon, our car lease scheme, our car benefit scheme, team are going to come and just do a bit of a Q&A webinar session. It'll be in the bulletin. The dates and the link. So it'll just be over Teams, so you can ask any questions if you're thinking of purchasing a car and you want to fully understand sort of the costs and the ins and outs of that, and the possible savings. So that's 15th of December, 12 noon. And then hot off the press, something that we will be launching in January. We have got a money and maths course. So anyone who's not overly confident in maths, the West Knox College are putting on a money and maths course for us. It's six sessions, sort of 1 week after the other, minus half term, starting on and the dates might have gone off my page. First one is 18th of January, so between 10. Actually, I'm going to say in the morning because I just need to double check the time with the team. So it is something that has been written and developed, and we're trialling here at Sherwood Forest for colleagues as well. So there'll be a limited number of spaces. There'll be about 12 spaces opening up for people to join that course if they want to learn a little bit more. So things like percentages, understanding interest rates, how much things cost you overall when you sign up to things like loans, your broadband, your phone, you know, the whole shebang, and a bit on budgeting, of course, as well. So I think that's me. If anyone's got any immediate questions, sorry, I've not kept an eye on the Q&A in the chat, or you can get me on the wellbeing email address as well. So if I'm not here when you ask a question, or you think of something, if you're anything like me, you're a bit of a reflector and you think of something, then do come through the wellbeing inbox to ask us any questions.
Wow, thanks, Amy. That was 100 miles an hour. We've got lots and lots and lots in that. Really good signposting to Money Helper and VivUp. Absolutely brilliant, and I've not seen a Money Helper before, so really important help and quite accessible there. And just your delivery there, I'm just thinking, you know, all the knowledge and experience that you've got, and you're getting it across that quickly. I was very reminded of Martin Lewis there all of a sudden, and what I did think about was about this Christmas present buying for people, and he's talking about having a prenup. So have a conversation up front with someone and agree no unnecessary present pact. But you need to have a conversation up front, because clearly, you know, if you don't buy the present, someone else does, you know, there's going to be some disappointment. But yeah, I think that's a really good idea, because, you know, we do tend to continue to buy presents and think sometimes, this is really difficult. I need to say something. Well, have that conversation up front and call it a prenup.
I like the phrasing. I've not heard that phrasing, Paul.
Yeah, excellent. Thank you, Amy. I haven't got any questions for you. You covered everything off. I'm not sure anyone's got any left, but certainly Money Helper and VivUp look like absolutely brilliant sources of help and signposting. So thank you for that. So Dave, I'm coming over to you. Follow that with your quality strategy.
Well, I've just been on the VivUp website. I didn't know that at all. That's fantastic. I'm looking for the ASOS vouchers for all my flipping children. I couldn't see them on there, but there we are.
Not a new jumper.
What are you saying? I can let the trust into a secret. This is my jumper. Okay, so I'm going to just talk about our new quality strategy. So just a brief little update on this. So for me and for us as an organisation, patient safety, clinical effectiveness, the quality of the care that we provide, they're at the heart of what we're trying to do. They're at the heart of our organisational strategic vision, and we want to continuously learn. We want to continuously improve. And so to help that process, we've developed this updated 2022 to 2025 quality strategy. And the idea is this will help guide us, that this will help drive us to improve the quality and the care that we're providing for our patients. And it builds on previous strategies, and you may or may not have seen previous quality strategies. This is something that as an NHS organisation we're required to produce. But this is a slightly different one we've done this year in terms of we've been out and we've harnessed quite a lot of opinion about what should be in our strategy, and we focused it a little bit differently from the sort of traditional metrics or ideas that we've done. It reflects the CQC domains, the safe, the effective, caring, responsive, and the well-led aspects. And it's got a series of what's called campaigns. It's got 4 campaigns that it's based on. And the first campaign is to create a positive practice environment to support the safest, most effective care. The second one's around excellent patient experience for users and the wider community. Third one's strengthen and sustain a learning culture of continuous improvement. And the fourth one's deliver high quality care through kindness and joy at work. And I hope what people sort of take from all of that is they're slightly different to the sort of traditional pillars that you base a strategy on. They're a bit more Sherwood focused, I would say, a bit more colleague focus, particularly, you know, some of those the ones over high quality care through kindness and joy at work, recognizing actually that is a key component to how we all interact with each other and how we can bring the best version of ourselves and deliver the best care at work. So for each of these campaigns, we've set ourselves some targets to measure our success by. And this strategy, which is currently on my desktop as a shiny document, has been printed and is about to be distributed out to the organisation. And the idea is that you'll see colleagues throughout the organisation describing and discussing this. And the strategies are great, but they're no use if they just sit on a shelf. And what we have to do is we have to take that and we have to own it to some degree, and we have to live it. And they'll only work if actually we all get involved in all of this. So we'll obviously put more comms around the internet pages and where we can have that, and we'll give some increasing updates on where we are. But if I could just give you some of the metrics that we've got for our creative positive practice environment support the safest, most effective care, which is the campaign one, which is the first one we're promoting. So we're going to focus on having a just culture. Now, there have been lots of discussions, and Paul and I have had some discussions in our trust board recently about what a just culture might mean for us, about being able to speak up, not having a blame culture, but actually having a more learning aspect and a more transparent, no blame approach, and sharing when things go well, but also when things don't go so well, and recognizing that, but recognizing the learning from it. So sort of developing aspects in terms of that, developing aspects in terms of clinical audit, in terms of clinical effectiveness, and just a couple of the metrics I've got down here. So this one was a really tough ask. I have to say that we did write this strategy a few months ago, and we've been waiting for the printers, but the first target was to be accredited as a designated pathway to excellence organisation. Ka-chink! Well done to Sherwood Forest. I tell you, I can't believe, I'm so proud of that. That's an amazing achievement. Amazing achievement. We're one of 4 or 5 organisations. That's such a huge achievement. Anyhow, so there we are. Increase the external accreditation of trust departments where available by progressing accreditation, and we've talked about departments such as radiology, cardiology, and ophthalmology, and hematology in terms of getting those. So there's a whole host of metrics that we've got there that we'll capture. And as I say, we're launching that first campaign to focus on that, to drive that positive practice environment and support safer and effective care. So I'll probably just stop there, Paul, if that's all right, and just take any comments or questions.
That's brilliant. Yeah, thanks, Dave. And as you say, you know, the real part of the what we're trying to achieve here is that we have something called a strategy, which maps out what we want to achieve, but it's not a document that gathers dust on a shelf. And just to bring it to life in the way that, you know, that one of the major objectives is accreditation, and that's all already started to gather lots and lots of pace, and, you know, we're really celebrating Pathway to Excellence accreditation as being the first step to do that. So that's fantastic. How are we going to keep it live? How are we going to keep it tracked, updated, and communicated, Dave?
So, as I say, we're starting on this first campaign, and we're doing it as a staged approach, and some of that will take the learning of how that lands, if you like. But we've got a series of metrics, a series of KPIs. We'll track those. We'll give updates. We'll provide regular updates through staff brief, through team, the communication, and also live on the intranet to do that. And of course, I'll be tasked. Both Phil and I will be tasked at Trust Board about updating. So there'll be plenty of opportunities to reflect and to cascade that through the organisation. but it's a very different way, I think, of doing a strategy. I think this is, it's much more of a bottom-up approach, and asking colleagues actually what's important to them about delivering safe and effective care, what makes a good organisation for them, compared to how we've traditionally done these sort of strategies that set some high-level objectives. I think it's quite exciting.
Brilliant, thank you. I agree. Okay, can't see any questions coming in at the moment. So I'm going to move on, if I may. So I'm going to introduce Martin Wilby, who is accompanied by Louise, Lauren, Lisa, Andrea, and Helen. And I think I've got that right. So Martin is from Project Search. So I'm going to hand over to you, Martin. Introduce yourself, introduce Project Search, and tell us why we should all get excited.
Okay, thanks very much, Paul, and thanks for the opportunity. So my name's Martin Wilby. I work for a national charity called DFM Project Search, and we run large-scale employment programs that support young people with learning disabilities or autistic spectrum condition to get paid employment, which is life-changing. We've got about 100 programs across the country. Significant number are in NHS trusts like yourselves, because you're huge employers. So why are we in the business of running these programs? Nationally, the employment rate for people of working age with a learning disability is less than 5%, which is absolutely appalling. We know it's been a really low number for a long time. We know from the work that we've done with Public Health England that work's good for you. So having a job gives you money in your pocket, gives you a large circle of friends, gives you health and happiness. So we're in the business of trying to create pathways that support young adults that wouldn't get that kind of opportunity to get it. The way we do it is we work in partnership with host businesses like yourselves. We are currently working at Kingsmill with your estates and facilities team, Skanska and MediRest. I've made sure I'm not going to name anyone because I'll miss somebody out and then I'll be in trouble. So I'm not going to name any names, but everybody knows who they are. We work in partnership with West Notts College, which is where Louise and the rest of the team are from. They provide us with a tutor and job coach, and with the interns, which are young people aged 18 to 25 with a variety of support needs. The programme we run, it's over an academic year, so it runs from September until June. Each academic term, so September till before Christmas, January until before Easter, after Easter until the end of the academic year, you do a different rotation each term. The young people we work with, they learn better by doing things. It's a bit like learning to swim. When you're taught how to swim, you're not sat in a classroom and given the all the kind of techniques and theory around swimming. You're put in a pool and you're taught how to do doggy paddle, and then you progress through the different strokes with support from a tutor or a coach. Our tutors, Helen, she's on the call. We've got job coaches, Lisa and Andrea as well. The outcome we're looking for, full-time employment for the young people that go through these programs. Our programs get 60% and above into full-time employment and 70% into some form of employment. We're looking for full-time employment because that's how you become financially independent. We've got graduates that are saving up for houses, getting married, having babies, doing everything that everyone else takes for granted, which you don't get to be doing if you're part of the 95% of people with learning disabilities that aren't in paid employment. So it's a huge burning social platform that we're working on. We're really keen to run as many programs as possible to help as many young people have gloriously ordinary lives. Just to give you a flavour of what's going on at Kingsmill, and the team can jump in and help me if I start to stumble over this or maybe at the end. You've got Nathan, who's in housekeeping. You've got Sean, who's in stores, and Reese, who's in estates. And just to give you a flavour of the feedback that's already been given, bearing in mind they're only in the first rotation because they're in term one. Feedback includes good timekeeping, the well presented, the polite, always helpful, fitted in well. I'm proud of him was my favourite, and that they're very pleasant. Yep. So what do we want? Why are we on this call this morning? What's our call to action? We want your help. We want your help to create opportunities for these brilliant young people, to learn transferable skills so they can either get jobs within the trust or external to the trust because they've got transferable skills. We're looking, what the young people need really is they need a network, not necessarily of support, but of opportunity. If we all think about our first jobs, quite often it was because we knew somebody that opened up a door or gave us a little bump up, we call it in Liverpool where I'm from, a leg up. Yeah. So we're looking for opportunities like that. You might be sat there listening thinking, oh, I'm not sure what I can do. You've actually got an opportunity to come and meet the team and meet the interns on December the 15th between 2 and 4. They're based in TB3 on level 3. So come in and say hello and meet them and learn about what they're doing and ask about how you can help. We're all hardwired to want to help. And it's a really nice positive thing to be involved in, because you can be the little step that helps somebody get on that lifeboat of getting a full-time job, saving up for their house and having that gloriously ordinary life. You might be sat there thinking, I'm a little bit unsure. Yeah, just come and ask. And there's generally 4 common concerns that stop people from jumping in and doing this. And they're around cost, capacity, safeguarding and fear of the unknown, and they're all really easily managed. Cost, there's no cost to host businesses for running this. There's enough funding in the education system, Louise might correct me, to run these programs. Capacity, everyone's concerned about capacity. If you've got someone new into your department, are they going to be tugging your shirt sleeve all the time? How do we do this? How do we do that? You've got on-site job coaches that are incredibly skilled at learning a job and then training the young person to do it. So you don't have to. You just have to tell us what the job is and what the quality standards are, and we'll train the young people to them. Quite often you're worried about safeguarding and or risk. The young people remain on roll at college, so they pick up everything around there, and they're experts in that, and they're experts in supporting the young people. Final one's fear of the unknown. I can understand this. I had this myself when I first worked in supported internships, which I've done for the last 6 years, and I was plonked into a classroom with a load of young people who had learning disabilities, and I'd never met anyone with a learning disability before. And a bit like I am now, I was really nervous and I was really frightened of saying the wrong thing. And a young person just came up to me and said, "What's wrong? You don't look very comfortable." I said, "I'm frightened of saying the wrong thing." And he said, "Don't worry about it. Just ask us any questions you've got." And it amazed me how incredibly open he was and willing to support me when I was supposed to be the professional that was there to support them. So you've got access to these incredible, brilliant people that will help you. Beautiful partnership working going on with a desire to create change in young people's lives. So get on board, don't miss out. I don't know whether anyone at Louise or Laura, if you want to jump in and add anything to what we've said.
You've done such a fantastic job, Martin. I don't really need to add much to that. I just wanted to sort of maybe mention one of our young people's stories. So what I'll just talk about Sean, one of our young gentlemen that's in stores at the moment, and his journey sort of through college. He probably never even thought he'd go to work. You know, his parents didn't even think he'd go to work. So to have access to a programme such as this and to get the level of support that he needs is, you know, is really crucial. You know, he was really worried about, he wasn't an independent traveller, so at the side of the programme as well, our job coaches teach our young people to travel to work, okay, because we know how important that is. And so he's he had to go over summer because he'd found some motivation to want to do that, to want to come to work. But he's doing absolutely fantastic, and I think a few of the comments that Martin read out earlier was from one of his mentors, Linda down in stores. You know, so our young people are learning skills, and even we didn't think that they had, because they've been in a college environment. You know, our young people have got such an untapped talent. You know, so if you're thinking about you know, areas that are struggling to recruit, you know, maybe come and speak to us and see if we can help you out with students. We have only got a small cohort this year, but we are working really hard with our business liaisons to look for further opportunities for next year. So we're planning on a bigger cohort. So if you want to be part of the programme and help transform our young people's lives, then either, you know, get in touch with myself, Helen, or the rest of the team, or even, you know, if you see us in the corridor, come and say hello, come and speak to the students, you know, see how they're getting on. It's just such a, you know, the team are passionate about what they do, and it's just a great thing to be part of. So come and speak to us and come and see us at there might be a mince pie in it for you as well. And I think, Helen, if I remember rightly, we've got a tombola or something or other.
We have, yes.
Either, Helen?
Yeah, hi. The interns have done several activities for the event as well. Tombola, there's a Christmas quiz, prizes to be won. So yeah, please do come along, come and see us, come and say hello, come and meet the interns. More than welcome.
That's brilliant, brilliant. Thank you. Thanks, Martin.
I think that's it from me.
Thanks, Martin and team. I said, Martin, when I handed over to you, you know, why should we be excited? So the exciting thing is creating opportunities for young people, and that's what we can do. Clearly, that, you know, you've got the support wrapped around the individuals to enable them to be able to do this. We've got the easy bit of helping them on that journey as well. So I think it's really important that we create those opportunities. Less than 5% in full-time employment is really disappointing. And you mentioned this, but I'd already made a note, Martin, that, you know, it's not employment creates health and well-being, but it creates independence. And that's just not open an offer to the 95% of young people with learning disabilities that aren't in that. So really important that we play our role. And I made a note of the date, so December the 15th, between 2 and 4 in TB3s, where we can go along, understand how we can help, meet young people who are already taking part, and meet you guys, you part of the team, and understand how we can do that. One thing that another note that I made, Martin, when you described something about helping these young people to have gloriously ordinary lives. It's by the sound of the percentages that you mentioned, most people with learning disabilities don't have gloriously ordinary lives, and we take it for granted. Notwithstanding, you know, we have our challenges, and Amy's helped us understand how we might meet some of them financially, but most young people with learning disabilities don't have this opportunity and can't have that glorious ordinary life that you mentioned. So really thank you for bringing that to life, and letting us know how we can create opportunities for young people. So thank you very much for that today. Well, I think we've got a record today. We've had no questions posted in the chat, unless the chat function's not working properly, Jess. But nonetheless, I can't see any questions. So has anyone got any closing thoughts they'd like to end today on, or just before I wrap up? Amy, Martin, team, anything further you'd like to get across?
I'd just like to say, from a money point of view, please don't suffer in silence and reach out. I know there's been in the past stigma around reaching out if you're having money troubles, but you know, there's independent services that can support you. And I hope you enjoy sort of spending with the saving that I've shared with everyone today. Let your colleagues know about it. There is another slightly more in-depth video, but obviously this team brief will be recorded as well. So if anyone has missed it, even if they can capture that bit, as well as the amazing work that Project Search have done and Dave's quality strategy. So thank you for having me, as always.
Thanks, Amy. On mute now, I've just realised. Any last comments, Martin or Louise or Lauren or any member of the team?
Yeah, that's okay. Yeah, thanks very much, Paul. It's about opportunity. Don't sit on the fence. Be part of the change. That's what I say.
Fantastic, thank you. Okay, so we've started to get a couple of comments. We already had one that was thanking you, Amy, for real tangible help, so thank you for that. And another comment about we should all be proud of our Pathway to Excellence accreditation. It is amazing. I've got a question around the update on next week's industrial action /strike. Got any any details as yet, and as I mentioned in the update, the intranet page and bulletins will be updated to keep everyone updated as we go through the next week, so we understand exactly what's in place and what is happening. Okay, so I'll draw today to a close. Thanks, Amy. Thanks to Dave, who's had to leave and jump off. Thanks to Martin, Louise, Lauren, Lisa, Andrew, and Helen for joining us. Yeah, I've made a list. I'm not falling into that trap of missing someone. Thanks to everyone for joining me and joining the team today. Thanks for attending. Hope you have a good rest of the week, and I'll see you all again next week. Thanks very much. Goodbye.